it was really strange. I could feel it permeating throughout my body. And it was like a rush I was getting. And all of a sudden I could see clearly, literally, while I was getting the infusion. And it was just for me like, oh my gosh, this is a miracle drug.
Thank you for joining us today on Mobile Nurse Revolution. I am your host, Will Bozeman, and we have some great guests today. I just wanted to point out quickly, if you're watching this and you have questions about mobile nursing or anything in that whole realm, different things you can do, questions you have, Kim is an expert, you will find out, and we are going to learn more about what she does in the world of mobile nursing. And we will jump straight into that now. Kim Fredricksen, registered nurse. And would you mind telling us a little bit about yourself, where you're from, if you feel like telling some of the details, and then we'll get into some of your experience as a mobile nurse.
Yeah, I'm from Tucson, Arizona. I've been a nurse 26 years and joined Relative. Well, it'll be 2 years in July. So this coming up, next July. So about a year and a half. But I did labor and delivery my whole career. So obviously women had pain during childbirth. So kind of used to that. But, in childbirth, they're giving usually, most of the time, some drugs. So, yeah, I kind of turned more holistic the past couple of years and just got sick of the sick model of healthcare and just decided I just want to work with people, holistically. Will's plan is nice with the machine because it is holistic. And it really made me love nursing again. I've hated nursing for probably the past 6-7 years and just wanted to get out of it. And so this has given me like a new love for nursing. It's really impactful for the patients.
Well, thank you. No, that's thank you for saying that. I appreciate that. I'm sure there's a lot of people out there who probably feel the same way you do. Now you have someone with you today, and she is also a nurse, correct?
Yes.
Kay Lombard. And Kay, you can, maybe introduce yourself, where you're from, and we'll go more into the mobile side of this.
Okay. I'm a registered nurse, and I started nursing school in 1976. So that just tells you a little bit about how old I am, 67 years old. And I primarily worked trauma or ICU. I worked in over 42 different hospitals throughout my career because I traveled for like 18 years.
Wow.
And so I was really cocky and really good. And then in 2003, I was assaulted by a 300-pound woman who had overdosed on heroin and PCP. And she broke my nose, broke phalanges in my neck, broke 4 ribs, and separated my brachial plexus from my bicep tendon.
Oh, wow.
So I have something that is called thoracic outlet syndrome. And as a nurse, in Arizona, it's a right-to-work state. So for 7 years, I struggled with passing out every time I hung an IV.